The commemoration of the World AIDS Day has been held in Wiyende district with a call to action by religious leaders to intensify efforts in addressing stigma against persons living with HIV. They emphasized parents having honest conversations with their children on spiritual values.
Parental guidance is essential to helping them make informed choices that protect their well-being. Let us embrace government programs such as UPE and USE to ensure our children enroll and remain in school.
Persons living with HIV call for the operationalization of the AIDS Trust Fund to address barriers hindering access to HIV/AIDS health services.
As a community, we are scared, we are aware of the dwindling funding towards HIV, but we are hopeful that government will take charge. Supporting access to government programs, facilitate and promote the inclusion of people living with and affected by HIV in government initiatives like the Parish Development Model, EMIOGA, and other social and economic empowerment programs. Addressing livelihoods is a key component for positive living.
Data as of December 2023 shows that 9 million people were tested for HIV in Uganda, an increase from 6.8 million the previous year. Among those tested, 144,000 were diagnosed with HIV, and 95% of them were enrolled on treatment. New HIV infections have reduced by 45% from 68,000 in 2017 to 38,000 by December 2023.
It means within a period of 12 months, that's the number of people who became infected. Your Excellency, to highlight, 15,000 of these were young people between the age of 18 to 24. And we have 4,700 children between the ages 0 to 14.
The Presidential Fast Track Initiative, launched in 2017 to end HIV/AIDS as a public health threat by 2030, is making progress with positive outcomes in testing, treatment, and adherence to medication. Prevention of mother-to-child transmission has also improved, with 4,700 babies born with HIV in 2023, a reduction from 5,900 the previous year.
It still shouldn't happen. We think that most of this happened because of stigma and discrimination at household and community level, but this can be reduced to zero as it's being observed in some health facilities. So, Your Excellency, here the issue is around the different leaders messaging about, the technologies and innovations available in the health facility and urging communities to use the services as much as possible.
Out of the 1.4 million people living with HIV in Uganda, about 1.3 million are on antiretroviral treatment.
Your Excellency, we've estimated that it costs about 700,000 Uganda shillings per year to maintain a patient on ARVs, including monitoring and testing. And I've spoken about the number of new infections, especially amongst young people. One of the reasons, sir, we see this is complacency amongst young people.
President Museveni cautioned against prostitution, which contributes to the spread of HIV despite the availability of drugs.
So you people, please don't keep playing around with this problem. Yes, the drugs are there. The drugs are there to suppress the virus, but it is not eliminated. But the advantage we are looking for in suppressing the virus is that when it is very much suppressed, it doesn't spread so much.
He commended scientists for developing a new injectable medicine and pledged support to researchers working to develop a vaccine.
As we are still struggling with the Kawuka, with the ARVs, with the Madagalagari war, our people have found the medicine which you take one pistol every 2 months. Instead of the every day empeke. So our people, I want to thank our scientists for really doing a good job.
The Global AIDS Report 2024 by UNAIDS reveals that 39.9 million people are living with HIV globally. In 2023 alone, 1.3 million people were infected, including 120,000 children. Ivan Kaahwa, UBC News.